Good evening all. Welcome to this Eagle Eye Spotter session set 2. So this is the first case where you can see both the lung fields are normal, cardiac shot appears normal, even visualized upper abdomen appears normal. But when you see clearly, there is a defect noted in the T8 vertebra which is mimicking the butterfly shaped. Here also you can, this is the zoomed image clearly showing butterfly shaped vertebra at T8 vertebral level. And this is the other case where you can see the lung shadows appear normal, even cardiac appears normal. However, when you see carefully the pedicles, when you observe the pedicles on both sides, on left side at the level of T11 vertebra, the pedicle is lost. So these are the common entities we commonly miss in these areas. So this first case was a butterfly vertebra at T8 vertebral level, and second is missing pedicle at T11 vertebra, which is nothing but winking owl sign commonly seen in metastasis. So common missed entities in these areas, in these radiographs, are vertebral defects, even pedicles, interpedicular distance, and even retrocardiac zones. These are the common areas we often miss. Next, this is other case where you can see right lung field appears normal, left lung you can see there is a hyperlucent zone or lucent zone with tubular branching opacity seen at the proximal to it. Here also you can see this is the central tubular branching opacity, and there is a peripheral hyperlucent zone distal to this central tubular branching opacity. So this was a case of bronchial atresia. So clearly you can see that hyperlucency of left upper and mid zone without hyperexpansion or volume loss with central branching opacity is suggestive of bronchial atresia. So the commonly missed entities or areas are subtle areas of air trapping, lucent zones, even small or minimal pneumothorax at the peripheries, and also small bullae and small pneumatocells are often missed. These areas should be seen very carefully. And next, this is the third case where you can see the visualized muscles appear normal, even the bones appear normal. But here when you see there is a fat density, clearly you can see there is a fat fluid level in the right common femoral vein, and also there is fat density in the left common femoral vein. So these are the entity that is, whenever you see fat density or fat fluid levels in the deep venous structures, definitely suspect fat embolism. This was a case of trauma 10 days back. So here the common missed entities is fat density or fat fluid levels in deep venous system, and this was a case of fat embolism. So fat density and fat fluid levels are often missed. Next, this is a case of back pain. If the patient presented with back pain, there was degenerative changes in the spine, but when you see carefully, there is a hyperintense mass lesion, isoto hyperintense mass lesion noted in the cervix with endometrial collection. And when you have taken sections further down, clearly you can see the large cervical mass causing cervical stenosis, and even there is endometrial collection. So this was a case of cervical neoplasm causing endometrial collection, that is hematometra or pyometra. So whenever you take a spine, whenever you see the cases of spine or whole spine, definitely try to see the lower pelvic structures, and sometimes, because commonly missed entities are uterine or cervical masses, ovarian masses, and even presacral masses, and even coccyx lesions. These are the commonly missed lesions. Next case, here you can see both are MRI brain. Here you can see when compared to the left phloid, this is the vertebral artery on the left side, this is the vertebral artery on the right side. Clearly you can see the vertebral artery phloid on the right side is lost. This is the vertebral phloid on the left side. So this was a case of vertebral artery thrombosis or occlusion. Here also you can see this is the phloid on the right side, this is right ICA phloid. But here when you see the left ICA phloid is lost and there is hyperintensity suggestive of thrombosis. So these both are cases of thrombosis. Right one is nothing but right vertebral artery phloid loss suggestive of right vertebral artery thrombosis or occlusion. Left side the case is left ICA phloid is lost suggestive of left ICA thrombosis. So the common missed entities in skull base or nothing but these sections of the brain are phloids, and also commonly missed areas are foramens in skull base. So always try to see the phloids, always try to see the foramens in the skull base, always try to see the symmetry, and also try to see the deep cervical spaces or cervical spaces. These are the commonly missed entities. This is also other case where you can see this is the left ICA, but the right ICA phloid is lost. Here also you can see this is the right ICA phloid is lost, suggestive of right ICA thrombosis. And also there are infarcts in the right cerebral hemisphere or right suprafrontal lobes, and also in the right half of brainstem. So this was a case of right ICA thrombosis causing infarcts in the right cerebral hemisphere, probably due to right MCA thrombosis. This is other case where you can see kidney, this visualized kidney, there is a calculus in the left kidney. However, when you see, there is a subtle air focus noted in the underneath the left dome of diaphragm, and also there is free fluid in the subphrenic space and also in the perihepatic space and the hepatorenal space. This is the zoomed image. Clearly you can see this is the free air. This is also zoomed image. Clearly you can see the free air under the left dome of diaphragm. So whenever you see subtle free air and also free fluid, definitely suspect haloviscous perforation. So this was a case of haloviscous perforation, that is subtle pneumoperitoneum and also free fluid due to perforated viscus. So the commonly missed entities here, subtle or minimal free air and free fluid, which should be seen very carefully, and we should be very cautious to rule out this. We should not miss haloviscous perforation or even ulcer perforations. And these are different cases of trauma which are having subtle findings. So here you can see in the first case, there is anterior superior iliac spine fracture. Here you can see this is the anterior superior iliac spine fracture. This is anterior inferior iliac spine fracture, and here you can see this is the greater trochanteric minimal depressed greater trochanteric fracture. So these are all three subtle fractures which are often missed. So this is anterior superior iliac spine avulsion due to sudden and forceful contraction of the sartorius and tensor fasciae lata in young athletes. Second case is anterior inferior iliac spine avulsion in epiphyseal avulsion, commonly seen in adults and athletes as a result of eccentric contraction of the rectus femoris. And the third case, that is greater trochanteric avulsion, which is nothing but epiphyseal avulsion injury seen as a result of contraction of gluteus medius and minimus, that is hip rotators. So these are the common avulsion fractures we often miss in pelvis. Thank you all.